Today I want to talk about the pain of more than a quarter century of misdiagnoses, of multiple birth defects, and the physical and emotional toll it has taken on me. Many doctors insisted my medical conditions were psychological, and I was physically fine. They told me it was all in my head. Learning at the age of 26 I was facing amputation, or double amputation, excuse me, is something that I don't wish on anyone. My name is Tracy Coval, and I'm from Norton, Massachusetts. It's an honor to be here speaking to you today. A little bit about me. I'm a motivational speaker. I'm a disability advocate. I'm a certified art therapy life coach. I'm an artist, and I'm a writer. And I may be a bit of a goat, but in good company, as you can see from my painting. My goal for the future is to put different expositions like this together where I can help others by sharing my story using the arts. Regarding diagnoses from birth, I had the following birth defects: Syringomyelia, tether cord syndrome, spina bifida occulta. I was unaware of these conditions until 2018 when I first met with Dr. Patrick Linga. In 2016, I was properly diagnosed with Ehlers-Danlos syndrome by a close colleague of hers. As you can see, I've had many diagnoses. I've had 17 accurate diagnoses and 5 inaccurate diagnoses. I wasn't born needing a wheelchair. When my legs worked properly, I could dance and cheerlead. Growing up, I had to deal with a lot of neurological issues, chronic pain. It felt like my legs were ice cold with severely intense burning pain, horrific muscle spasms, back pain, joint pain, difficulty urinating, bowel issues, migraines. As a child, I saw a minimum of 20 doctors. I was diagnosed with complex regional pain syndrome in my left foot and ankle fall of 2002. I was 11 years old. My doctors reminded me often, suck it up, you'll live. Treatments that were tried included the following: medications, physical therapy 5 days a week, CBT counseling weekly, biofeedback, mirror therapy, TENS unit, aquatherapy, Reiki, acupuncture, chiropractic work and kinesiology, hypnosis, herbalist, acupressure, medical procedures including nerve blocks, lidocaine infusions, and I did an intensive inpatient physical therapy program. I did this twice, both at age 12 and 14. My learning disabilities included dyslexia, dyscalculia, auditory processing disorder, short-term memory, difficulties with comprehension. And you can see I'm a little bit dyslexic since it's out of order, so you get a little bit of it. So I turned to art. It's the one thing I felt good about. Art runs in the family. This slide displays artwork from my grandmother, Helene, and me. Despite my grandmother having dementia, she's sharp as a tack with her paintbrush. Art is something that we can still share together. I focus all my energy on the arts and work closely with my grandmother, as you can see. The artwork in the middle highlights how in disability and diversity, one needs a helping hand. You can't do it alone. I also pressed forward my education. I graduated Lesley University in 2013 with a Bachelor of Science, majoring in counseling psychology with a specialization in art therapy, work experience in the mental health field, as well as disability advocacy. Pursued a Master's of Social Work in 2013 with intent to graduate May 2016. In 2015, things got worse, much worse. On September 24th, 2015, I lost control of my car while I was driving home from my internship. Paramedics had to pull me out of my car and carry me to the stretcher. My toes, feet, and ankles were curled under me and completely contracted. Doctors were accusing me this was all psychological. Now, before I go into the next couple of slides, I want to make you all aware that the photos you'll be looking at are graphic. I really want to drop F-bombs during the next 2 slides, but here's the thing. I have a bet with my father that I wouldn't. Guess what, Dad? You lost the bet. The photos you're looking at are the progression of my leg deformities. It was determined my toes were paralyzed and my ankles were frozen. Surgery was the only way to repair the damage to my legs. At this point, I was unaware that my leg deformities were due to birth defects. I was told to prepare for amputation as there was a 90% chance the surgeon would not be able to save my foot. I'm grateful I was in good hands. The third photo is what my foot looked like 2 weeks out of surgery. In the fourth photo, the embedded pin marks you're looking at were from my leg resisting the walking boot. The spasticity was severe. In this slide, you are witnessing miracles are possible. The left leg was surgically repaired first and needed 3 surgeries. When I was told I was facing amputation on my right foot, I was terrified. Before I was rolled into the OR, my surgeon looked at me and said, "Trace, this is coming from your spinal cord. That's the problem." The third photo is what my foot looked like 2 weeks after having the surgery. This was the first time I'd seen both of my feet together with all 10 toes. The last photo you're looking at are my legs at this present day. I smile every time I look down and see that my feet are still here. I've seen a lot of doctors in my young life. 112 doctors seen as an adult. 18 doctors diagnosed me with CRPS RSD. 2 doctors diagnosed me with acute dystonia due to drugs. 11 doctors diagnosed me with functional neurological disorder. 2 doctors diagnosed me with conversion disorder. 1 doctor diagnosed me with psychogenic pain. Treatments that were tried included the following: 111 PT sessions, 65 OT sessions, 4 rounds of Botox, 6 rounds of manual manipulation to break the fixed contractions, 3+ years of counseling, 25 ER trips, 15 hospital admissions, 3 unnecessary surgeries, 6 necessary surgeries to correct birth defects and leg deformities, 9 total surgeries to date, 3+ future surgeries. The photo you are looking at is about 2 weeks out of post-op, about maybe 6 to 8 weeks ago, getting the spinal cord stimulators taken out of me that should have never been put in me in the first place. When they were finally taken out, they did the MRI and realized my spine was in a lot worse shape than we thought. So I looked to make bitter lemons into sweet lemonade. The photo on the left, I was 72 hours post-op from the second surgery on my left leg. Clearly a surgery wasn't going to stop me from laying in the sun or lounging in the water. Working on my tan is a priority. The photo in the middle was the first time I had seen my left leg after 3 surgeries. These surgeries all occurred within 7 months. My heart was full seeing my ankle, foot, and toes were saved. This is a memory I will always cherish. The last photo was 13 days after I just learned I was born with syringomyelia, tether cord syndrome, and spina bifida occulta. Now, anyone who knows me is aware that I'm a diehard Justin Timberlake fan. First step is acceptance. With the help of one of my best friends and a wish grant organization, I was able to see him perform. My facial expressions in this photo doesn't need any further explanation. 6 days later, I underwent neurosurgery with Dr. Patrick Linga to untether my spinal cord. Ask yourselves this question. If you were misdiagnosed and that misdiagnosis altered your life greatly, how would you cope? Take a moment and think about that. I went to my art to help with communication. As you can see from my 2 paintings below, I was trying to show how I conceptually understood what was occurring in my body. The art piece on the left is how I envisioned tether cord syndrome, and this is the piece that Dr. Linga had been speaking about. I thought of my spinal cord as rope, as my spinal cord was tied to my tailbone. As I continued to grow, the rope would pull my spinal cord and restrict the movement. The piece on the right was inspired by my recent spine x-rays. Painting the structural anatomy of my spine helped me understand that I was born with this. This wasn't psychological. The textured bold background represents the red flags indicating my spine was screaming for help. Art can help with the healing process. According to renowned art therapist Kathy Malchiotti, creative activity can actually increase brain levels of serotonin, the chemical linked to depression. The piece on the left focused on how I could turn the grieving emotions I was feeling and use it as my strength to keep going. The symbolism of an elephant is strength and power. The art piece on the right is a portrait of a close friend who passed away by suicide. The blue monochromatic theme shows the pain of loss. The lighter blues highlights her beauty and gift to this world. To help with the healing process, I painted the evolution of my legs, which you can see one halfway and then two on the same level. We're good. The painting on the left is what my legs look like in 2016. This piece was inspired from a photo that was taken of my dog and me. At this time, it was determined my toes were paralyzed and my ankles were frozen. My legs were stuck, locked in fixed contractions. I kept being told, "You're faking this." If you look closely, you can see my dog's tongue. He would try to break the fixed contractions. The painting in the middle is what my foot looked like 2 weeks after the first surgery on my left leg. This was the first time I'd seen what my foot looked like at this point. The pins remained in my toes for 3 months. The final painting on the right is what my legs look like now. The spasticity is so severe in my legs that you can see the tendons popping out of my legs and feet. If you look closely, you can see my second toe contracted under my big toe. 4 massive reconstructive surgeries have already occurred, and at least 2 more are necessary. My medical team refused to give up the goal of me walking, and I refused to as well. As Kathy Malchiotti states, art making is an activity that can generate self-esteem, encourage risk-taking and experimentation, teach new skills, and enrich one's life. Renowned psychoanalyst Donald Winnicott believed the goal of therapy is the creation of a holding environment where people are given the chance to be creative, let go of unauthentic self-images, and shape the true self. The artwork on the left, I was trying to illustrate that I will never give up hope. Anyone with a medical condition prays that one day a cure will be found. This piece was selected for the Art League of Rhode Island's exposition on interpreting brain and spinal fluid disorders through art. It will be on display at the Warren Alpert Medical School Atrium Gallery until August 21st. The art piece on the right focused on the overwhelming emotions I felt when reality of my medical situation sank in. Oh my God. I was born with birth defects that went untreated for 27 years. If someone had listened to me, I may not be in this chair today. The inspiration of this piece was from a candid photo a friend took of me with my dog. This piece represents sadness, anger, frustration, defeat, freedom, relief, and strength. I've always been a firm believer that everything happens for a reason, and I'm thankful to be here in front of all of you today to share my story. Without the use of art, I would not be able to heal and express myself in a healthy manner. Completing these art pieces for today's conference has helped me prepare for my upcoming spine surgery, scheduled in 11 days. I want to personally thank the people that have gotten me to where I am today. My medical team, thank you for never giving up on my case and continuing to fight for me to succeed. My family and friends, thank you for putting up with my vulgar language and supporting me through the toughest times. They continue to remind me to just keep swimming. My editor, Greg O'Brien, thank you for believing in me and mentoring me. The Art League of Rhode Island. And finally, Dr. Patrick Linga. I now want to invite Dr. Patrick Linga up on stage as she played a crucial part in my health. You have to come up.
Tracy, thank you.
Oh, I'm not done yet.
Sorry.
Can I borrow your legs? Because mine don't work. Can
Yes,
I
of
have you
course.
grab the art piece that you love?
Oh, you do want me to be on stage?
Yeah,
Okay.
There's a plan. There's a method to my madness.
Please instruct me.
Okay, can I have
I'm
you please
listening.
grab the piece that I explained my interpretation of tether cord syndrome?
To take it?
Yep. I want you to hold it up, please. As a thank you, I would like to present you the original art piece explaining my interpretation of tether cord syndrome. Without your expertise, I would have never known I was born with these birth defects. You've given me the ability to feel at peace with myself and understand this was not psychological. Thank you for saving my life. You've helped me be free of this dark, sick nightmare. I can officially end this chapter and move on to the next one in my journey through life. Thank you for all that you've done for me. Yep, you're good now. And I will ask for the other artists to come up for questions and answers. Steve. That's what I was instructed to do.
If anybody has questions. I thank you, Tracy. This is beautiful. I just want to say that, you gave a great roundup and a synopsis of what it is if you are an artist advocate and a patient advocate. And certainly, we all face the unknowns. This is scary. But I think, we're in this together and we are partners in this, right? Thanks
Thank you.
for your lecture.
Thank God I'm wearing waterproof mascara. Thank God.
Before we have a little bit, we certainly also have to get some adjourn remarks. But before we have, some questions for the artists, I just want to mention that Dennis O'Brien, who was very excited in coming here, had personal matters that made him unable to join us here. But he is, I know we are in his thoughts, and we have him in his thoughts. Dennis is also associated with the Art League of Rhode Island. He's a nationally accomplished artist who, if I'm not mistaken, does a lot of also healing and creative healing for himself, also being a patient, and like painting and drawing and how that creates good emotions and positive vibes. Exactly. Is that correct? Yeah. So that's his agenda. Just want to mention him, and yes, certainly we can have a few minutes if there are some questions from the audience. Maybe just to the artists, we're happy to take them. I think go ahead. Do I hear something? I think that speaks to that we had a lot of full and rich lectures from everyone, and I was touched and very enlightened by the synopsis we had today, and I think my resolution or conclusion is that there's more to come. This is the start of how we all can work together to improve the management of all the difficult things we have to tackle in medicine, and all the players were here, and I thank everyone. I want my co-chairs to just come up and say a few words as an adjourn, and thank you, Francois and Alpert, for joining me in this.
Thank you. Just make it short. I would really like to thank Patrick Linga for putting up this conference. Personally, first of all, I don't know. I think my feeling is pretty much the feeling of most of the speakers is the first reaction is, what am I doing here? This is not at all my wheelhouse. And this has made it incredible because there are people from so many different disciplines, whether it's physicians, patients, artists, engineers, and that's what made this absolutely unique. I'm not aware of any other conference anywhere else. So this is fabulous, and thank you very much, Petra. This was beautiful.
you. I would echo Dr. Lux's statements. This is just a phenomenal conference. It really would never have come together without the vision of Dr. Linga. I don't know that any of us would ever be able to bring these separate, disparate elements together to really make such a cohesive, wonderful healing environment. So thank you all for coming.